Welcome everybody today for the second day of EATRIS meeting, and I am your moderator. My name is Inese Cakstina, and I'm from Riga Stradins University, and I'm very happy actually to give the stage to the EATRIS Scientific Director Toni Andreu and EATRIS Scientific Program Manager Emanuela Oldoni, who are going to be giving the overview about the EATRIS. So the stage is yours.
Thank you so much. Okay, we have a slot of 15 minutes to share with you what EATRIS is, because it's a little bit of a complicated concept. Yesterday we had a meeting with the members of the EATRIS Latvian community, and I see today new faces as well. So we are trying to present a little bit of a condensed overview. Because the good news is that the Latvian government decided to join this organization, the European Infrastructure for Translational Medicine, EATRIS, whose main aim is to create a community of practice across Europe for facilitating the development of translational medicine. We are what is called a distributed research infrastructure. And this is a very interesting concept because you see on the left the example, let's say the gold standard of what a research infrastructure is. In Europe, we are talking about a concept at the European level, right? And this is the classical research infrastructure. The CERN, the International Consortium for Research on Atomic Energy, the Large Hadron Collider in Geneva, that represents an international consortium of several countries that decided to create from scratch an infrastructure to do research on physics. Very simple. We are something similar. We are also an international consortium of members. In our case, 14 member states of the European Union, and now Latvia being one of them, that have decided to create also an infrastructure for doing research in the area of translational medicine, understood by the process by which the knowledge that is generated by science is translated into a real and practical solution for people's health, a diagnostic, a therapy intervention, or preventive activity. The difference is that instead of building something from scratch, what we are doing, what the member states decided to do, is to use the facilities, the institutions that already exist. But the concept is that we act as a community of practice, and in fact, we are a legal entity that can act independently. That's interesting because from now on, those institutions that are going to be part of the EATRIS Latvia community will have the identity, of course, of their own institution, but being members of the European infrastructure will also have the identity of the European organization. So this is the current, let's say, reality of the organization. EATRIS, the European Infrastructure for Translational Medicine, with this distributed model, is an international consortium formed by 14 European members, 14 European member states, that decided to be part of the organization because that fit in the strategic agenda. And after a few years of what we call being observers, Latvia, the Latvian government, decided to be a full member at the same level that France, Italy, Spain, or other countries that are part of the organization. Altogether, the network I was talking about, these facilities, is literally a group of 150 research institutions in these 14 European countries that have something in common. They work on translational medicine in different disease domains, different scientific capacities, more from basic science, clinical research, preclinical research, regulatory science, all the elements of this complex value chain that is called the translational medicine process. And they come to the organization, and with their capacities, the institutions that join EATRIS, they plug into a structure where the capacities are organized in 5 different scientific and technological domains: advanced therapy medical products, biomarkers, imaging and tracing, small molecules, and vaccine inflammation and immunomonitoring. What I'm saying is when you guys join EATRIS, you are going to work together with colleagues from other 13 European countries whose expertise, scientific and technological, fits into these 5 qualitative blocks. And being an international organization, we have the capacity of being independent, developing our own agenda, applying to grants, being present in policy forums, and so on. So, how is it organized? a little bit of a snapshot. I say an organization, international European organization, formed by 14 countries. Every country is what we call an EATRIS national node, which represents the institutions that are part of EATRIS in a given country. And EATRIS has a coordination and support team based in Amsterdam, where Emanuela, Elise, and I, and other approximately 20 more, 5 colleagues work with the specific mandate of coordinating and supporting the activities of the entire organization. So the organization is kind of this hub and spoke model, where the central hub in Amsterdam kind of helps the activities and the coordination of the different member states. And here you have the example of one member state of EATRIS, France, that has inside the different institutions, the different scientific groups that work in these 5 areas of competence of the organization. And you see that below the name France, there is a very important element which is called national coordination. Because in the EATRIS model, every member state has 2 key people working in the given country. One is called the national director, in this case Liene, and in the other is called the national coordinator, in this case Riga, whose specific functions are to represent the activity, the scientific activity of that community and help them to connect with the mainstream that happens at the European level. The scientific director puts most the focus as being the representative of the scientific community of a particular country, more at the strategic level, I would say. And the national coordinator is, if I can compare, although it's not exact, it's like a little bit the EATRIS manager, the operational power of the activities that are in the country, with the specific aim of making sure that you take advantage of all the possibilities that EATRIS gives you as an international organization. What do we do? I say translational medicine as the process by which the knowledge generated by science is translated into an intervention for people's health, a new drug, medical device, diagnostic process, etc. That is not easy because it's not only about science. It's about a long value chain with many other stakeholders, industry, policymaker, clinicians, the patient organizations, of course, regulators. They have to work together to make sure that at the end this new drug and this new medical device arrives to the patient. And the specific role of EATRIS is to work with these communities for making sure that this process accelerates. Emanuela will give you a few examples. And basically, the kind of activities that we perform are grouped into these 4 categories. One is being scientific leaders and technological, let's say, experts in different areas. We have the capacities of providing services to other European countries. By the fact of being in EATRIS and bringing one specific technology in one institution, automatically you have the possibility of giving services, of course, paid services and supported, to other stakeholders, organizations, industry from other countries that are interested in that particular service. As we represent a large community of expertise, scientific and non-expertise, we also have a very active role of working as a community, developing the new research tool, working in proposals as a community to get funding for developing the new research tools that will mark the progress of translational medicine in the future. Strong education and training programs, and at the end of the day, improving the conditions for translation in Europe. My take-home message is, EATRIS, at the end of the day, in simple words, is a door that has been now open for the Latvian community, that you have the decision if you want to cross and enter and connect with the mainstream of other activities that happen under the umbrella of the organization. And also, at the European level, we have the privileged opportunity of learning from you about your own strategies, your own science, and their own development of the translational medicine ecosystem in Latvia. And I'm going to give the floor to my colleague, Emanuela, which is going to give you specific practice examples of the kind of activities we perform.
Thank you, Toni. And yes, so we are using European funding as instruments to build the capacity, the capabilities, and the tools that Toni already just mentioned to you. So in this slide, you can basically see a large portfolio of services that of projects we are involved in, and highlight in the red squares also that one focus on personalized medicine. But to give you a bit more the grasp of how we are strategically and operationally working. So in this slide, you can see at the center what the PMNET called the system of health. In personalized medicine, we have three main areas, personalized medicine related with research, with innovation and implementation. And through projects, EATRIS is trying to building solutions to tackle key challenges in the field and promoting personalized approach implementation in different healthcare systems in Europe. So I would like just to highlight a couple of projects where we are involved, and I think that we are trying to make the difference on the European level. So first of all, we are collaborating with the European Partnership for Personalized Medicine, PMNET, as the key stakeholder there. We have also, we are also partner in a lot of initiatives that you can see in the slide for data related, so building data capacity and infrastructure. We are involved a lot in policy making, influence, and try to support researchers on understanding the translational value chain and the gatekeepers, and try to with providing key solution. For example, in Precise EU is a beautiful example where we are trying to mapping different healthcare systems in Europe and which are the challenges they are facing in implementing personalized approaches. And then we are trying to even go beyond and provide recommendation in order to facilitate implementation of personalized medicine in the different healthcare system. And another important, let's say, initiative we are involved in is at global level with the Personalized Medicine Coalition. That is an American, US-based organization that includes industry, policymaker, researchers, and wants to implement personalized medicine in US. And we are involved in a project with them. But let me just go quickly through some key initiatives. The first one I want to present you is CanServe. This is a good example how we are using the European funding to strengthen our capacity to deliver services, in particular in the cancer field. So CanServe is a project that developed a catalog of 400 services across 10 different research fields. And this was possible because the 14 research infrastructure in Europe that are focused on medicine and life science put this effort together to build such portfolio that is very cutting edge, and by offering these services to the community, we really want to make an impact on the development of cancer research. It's very easy. We develop also a single application platform where everyone can just go into that, register, and look for the in the catalog, which are the services that can support your research. And then there is an application that has to be made. The application will go through a review process, and after which, if positive, the applicant will receive the service for free, in the sense that the project budget will cover for it. I kindly invite you to look into that a bit more in depth. In particular, now we have opened 2 calls, one with deadline end of November, one December, but new calls are upcoming. So if you are working in the field and you need specific capacity, I think this is a great opportunity for you to get them. And then another way EATRIS is working is really like building communities across challenges. So try to answer to specific challenges that different researchers across Europe are facing. And here we have 3 examples. So we are using the cost action program, that is a program funding that funds the construction of networks. So researchers can come together around specific topics, and then once there are like actions to be built, in particular resources like recommendation, literature analysis, but also education and training. And after that, in this way, we are trying to create like core teams around specific topics. And if in future we will have opportunity from like Horizon Neuron program, we already have a nucleus of experts that already know each other, that they know how to work together. And one example was the long COVID net. Basically, here we identify long COVID as still something to be explored further at the European level. So we organize a workshop in our community, we put together people, and we, also Latvian colleagues are involved in the proposal. And another beautiful example is this other cost action that we are going to resubmit because it didn't pass through the first phase, that is called Cell-X-Track, about tracking cell therapies. And also there, we had the idea, we put together the team, we prepared the proposal, and then the idea is actually look more in the long term to put together the team for future application, the HI called. Also here, we have Latvian colleague involved. And then finally, we are putting together also a cost action around CAR-T therapy. So I already asked a few of you if you have partners that you know might be interested in joining such consortium. We are really looking forward to engage with also Latvian researchers. And with this, I would like to thank you all and to thank our funders and partners. And I'm happy to answer to any question during the panel.
Thank you very much. Yes, there will be a panel discussion afterwards. So I would like to invite now Edvards Kuks, who is from Ministry of Education and Science, and he will going to talk about the vision Latvia as a member state call for action for potential partners.
Yes, thanks for the introduction. When I was asked to speak, initially I was indeed asked to give what are the government's, let's say, needs or expectations from EATRIS. That's not what I will be presenting today overall, because when really the expectations are quite similar overall to our expectations of our involvement in ERICS more generally, but I will spend a little bit on time time on that in the end. But I thought a better question that I can answer is, where does EATRIS fit into what we are doing in R&D policy overall in Latvia? So knowing that I'm a bit short on time, I will run through, well, I don't think I need to spend time on this. We are there, that small yellow dot. We are doing well in some indexes, and we are quite small, also in terms of inhabitants. This is in a few key figures. This is where we're at in 2022, which is our most recent data. 2023 isn't out yet. About total funding, 2022 was also the first year when business R&D funding surpassed public sector R&D funding in Latvia. One of our key goals is research personnel renewal, so we're a little bit under 7,000 FTE right now. We are working towards increasing that. Our stated goal is 8,000 FTE. About some sort of strategic framework, we look at our investment primarily through 5 smart specialization areas. Obviously, the most notable one for this forum is biomedicine, medical technologies, and biotechnology, but of course they are all interlinked. And of course, some of the key research institutions are here today. University of Latvia, Riga Stradins University. I think I've seen also people from the Organic Synthesis Institute and others here as well. So what are our goals and our vision? Basically, we are working towards, of course, improving the governance of our scientific institutions, having success built on cooperation both nationally and internationally, increasing the impact of science, striving for research excellence in well-governed institutions. Yeah, this is the 8,000 FTE. These are some of our main goals in our strategies. But moving forward to where we are now. So if we look at share of R&D personnel in total employment, we see that although this is still a major challenge and we are still, let's say, far below the EU 27 average, we see that there is steady growth since 2016-2017. We are currently in the process of launching a new doctoral studies model and also launching both doctoral and postdoctoral grants. We see that in the population structure of our research personnel that this is bringing fruit, in that not only is the amount of researchers increasing, but also that, let's say, target groups of young researchers are increasing more rapidly, which is a key point for us. I think the most rapid growth is in the group 35 to 44, which is exactly the post-PhD age where you have these young researchers. In terms of research excellence, this is something we can be quite proud of. The way that we fund science has moved towards more results-based funding, which means that people are highly encouraged to publish in Scopus Web of Science journals, and there are, let's say, coefficients for Q1, Q2 publications, so we see that this brings rewards. The rapidest growth in publications is in Q1, which we can be quite proud of. So it's both, so we see that out of growth of quantity, we get growth in quality. Of course, very central to this forum is the growth in international collaboration. We have highlighted some international formats that we have been more active in recent years, but we see that we in fact have higher the percentage of total publications in international collaboration than average in Europe. Why is that the case? Well, as a smaller country, it's more important for us to build these international networks. We see that this is somewhat stabilizing, which is interesting to see if there's going to be some point at which it truly, if it evens out 50% or something like that. So, and if there's no, of course, it's not an interactive map, but we see that our strongest collaboration is, of course, in Europe or in EU, although we have broad global collaboration. And also I would like to highlight the role of Latvian diaspora researchers, which has been quite important also in our international organizations, so, such as us joining the EMBL, etc. So this is where we are at overall. And perhaps to see how this works from our instruments, all of our instruments, both our direct support, so our government funding and EU funding, and our indirect programs are all driven towards increasing the ability of Latvian researchers to successfully participate in international networks. So if we think about where does EATRIS fit in, EATRIS fits in the middle part of these international R&D activities that we want to foster with our support programs and mechanisms. I will also give a brief overview of our Horizon Europe results, although this doesn't include, I believe this doesn't include the teaming project that we just saw, the consortium agreement being signed today. So Latvian project proposals 1144, about 22% success rate, which is pretty much the same across all three Baltic states. What we have seen and what has been our message is that what we see as critical is increasing participation, because our Baltic colleagues in Estonia and Lithuania are more active, but the success rate is about the same. This is by thematic area. I won't spend too much time on this. And this is, again, not counting this teaming project, this is the per institution. Moving on to ERICS in Latvian research landscape, I would like to thank the previous presenters that I don't have to give a full explanation of how ERICS work, but Latvia is taking part in 8 ERICS fully as part of our S3 roadmap, but there is funding, we are funding our participation in these, and we also have additional funding for ERIC coordination on national level, both for the ERICs that we are part of and some that are in the, let's say, in our future prospects. This is crucial because we see that this allows us to foster community on Latvian level, and the requirement for coordinators in exchange for this is holding training events, building collaboration with different institutions, and building links with the international ERIC membership. So overall, the impact of ERICs is the ability to engage on this international infrastructure. Of course, standardizing data and research processes allows more high-impact research, but in simple terms, it's skills, it's visibility, and it's also the new career path prospects for research leaders. In terms of EATRIS added value, just a few thoughts about benefits for research and translational medicine. Of course, this access to infrastructures, I believe, is key. We cannot think of infrastructures as divorced from the tools that we use. So this is also infrastructures and tools. It also provides access to a marketplace for research services, both the existing services, but if we think of the growth of Latvia's participation in EATRIS, about the services we can also offer perhaps in the future. Of course, we looking to the future also on EOSC integration. Without these ERICs, we cannot reach full EOSC integration into EOSC. And of course, more general high-quality publications, but also there are specific challenges we see in medical research that have to do with challenges to do with open science and translational research that we believe these networks to be particularly valuable for. And as for benefits for translational medicine, I understand this was very much discussed also in yesterday's panel, but of course benefit sharing, increased patient involvement, the value of public research infrastructure especially for rare diseases, and especially in small country we cannot have the same amount of reach that we can with a network, and of course competitive innovations for new equipment and so on. I think I'm okay on time. Sorry for running through some of the slides, previous slides a bit fast, but I know that the Latvian audience here is probably well familiar with at least most of the information. Thanks.
Thank you very much. So we are actually very good on time, which is planned now. And I would like to invite now for the very special moment, the signing moment, all four representatives from all four participants in EATRIS in Latvia. So it's my honor to invite Agrita Kiopa, Vice Rector for Science, Riga Stradins University. Then I would like to invite Osvalds Pugovics, Deputy Director, Latvian Institute of Organic Synthesis. Nils Rostoks, Director of Latvian Biomedical Research and Studies Center. And Gunter Skittenbergs, Vice Rector of Research, University of Latvia. So you all have the memorandum now of the participation in EATRIS, so please take a seat and sign the papers. So we have to check that everything is signed 4 times with the 4 representatives. And if everything is signed, I will kindly ask all 4 highly excellencies to stand and take a picture with for the official history books. So thank you very much. Now we all are bound by EATRIS. And I hope it's all going to be really fruitful partnership with all 4 institutions. So now we can move on to the next part, which is much more less official and more relaxed, which is called panel discussion. And we have many amazing panelists that I would like to ask to take your seats up here. So Baiba Ziemele, she is actually very famous in Latvia as a patient representative. She's a coordinator of Patient Organizations Network in Latvia. Thank you, welcome. I'm very happy to welcome Professor Zanda Daneberga. She's a Deputy Director for Molecular Oncology, Institute of Oncology and Molecular Genetics at Riga Stradins University. Then we are going to have, I would like to invite Osvalds Pugovics, Deputy Director of Latvian Institute of Organic Synthesis. From Latvian Biomedical Research and Studies Center, it will probably going to be Davids Fridmanis, although it's written that it's supposed to be Kaspar Stars. But okay. And Deputy Director, University of Latvia, Institute of Clinical and Preventive Medicine. Actually, now it's the Faculty of Medicine and Life Sciences, Ilmars Stonans. And it's all going to be, I will not going to be your moderator because you will going to have fantastic moderator, our EATRIS scientific director, Toni. So, Toni, I'm going to give you the microphone here. Okay.
Thank you.
Okay. So, floor is yours. And
thank you, Inese. Okay, thank you to all of you. Yesterday, we had the, let's say, the official, let's say, kickoff meeting, and we had the opportunity of discussing with many of you. Maybe we have a slightly wider audience, and I'm very happy that there is a representation from the ministry, right? Because we are facing something which is exciting, but it's also very challenging. We call this translational medicine, and it's not developing, you know, something from a strict scientific perspective. It's working on a process which is long, bumpy, challenging, sometimes frustrating, right? By which the knowledge generated by science after this long journey, sometimes years, is transformed into something that makes a difference in people's life. And for me, there is one characteristic which is absolutely essential of this process, which is the fact that that needs multidisciplinary cooperation and alignment with one objective of people, organization, and expertise that have different history, different capacities, different understanding of what science is, right? So in that sense, this is the spirit of EATRIS, and I'm very happy that we have here a community that represents this diversity, including one key stakeholder in this process, which is the patient voice and the patient perspective. We cannot move forward in the translational medicine process without having all these ingredients in this recipe, including the patient perspective, including the industry perspective, including the perspective and the strategy of the policymakers. And this is a challenge for the entire society. So the first question I want to ask you is, how do you see this challenge of us, a community in Latvia, of scientists, technologies, industry, patients, that have the potential opportunity of working together for not only generating knowledge, which is an important essence of the scientific identity, but also to create a solution that is going to tell one citizen, listen, I'm helping you because I develop a new drug, a new intervention for the disease you are suffering from. What's your perspective in this new journey? Who wants to take first? Ilmars.
Thank you, Toni.
Easy question, eh?
It was a question. Okay. I would be able to speak more than an hour about this. And I believe any of us would need at least an hour to scratch on the surface. But the simple thing is, the key word is cooperation. To find common language between all stakeholders. It is actually the most difficult task. And even if we are speaking the same language, we usually speak different languages between different stakeholders. As quite a lot of us speaking not only one language, but at least a couple of them, we've been in the situation of translators. But I believe at least some of us here have been also in the situation of the translators between the understanding of the same problems in different professional fields and also different fields of public, private, political, patient stakeholders. So first of all, we need to learn the language of our partners. That sometimes, not sometimes, it's also always very difficult. And I don't believe that this is realistic, but what we could do is to engage the translators in this process. The people who speak at least most of the languages of the stakeholders so they can translate the needs of other partners to other stakeholders.
We mentioned before, and following this kind of concept of the translation, right, of making something practical, I think obviously a key actor is the industry, right? And industry plays an essential role in making sure that all these scientific discoveries are going to be brought to the society in an efficient manner. And I think that Osvalds in the Institute of Organic Synthesis have a strong record and a very interesting vision of the collaboration between science and industry in Latvia at a general level. What would be, let's say, your recommendations or your vision for making sure that this scientific community in Latvia is going to play a real translational role in cooperation with the industry as effectors of the development of these solutions?
Thank you. Does it work? Yeah, it works. I think the most of problems arise from bad communication. So we have to talk to our partners at industry side. We have to show what we are capable of, and we have to learn what they are expecting, and they have to learn what we can give. So otherwise there will be expectations which are way too high or way too low. And this also includes respect for partners. There is no one who is the most important or less important, except, for example, maybe patients, which are the most important partners in this community. But the researchers and industrialists involved in translation of research findings into real products, they are all equal, and we have to respect that. And I think that during the 60 years experience of our institute, we have collected quite a good experience in that. We are ready to share, and we are ready to listen. Thank you.
I think that the point that you made about respecting and listening to each other is absolutely fundamental. And in the last few years, I think the scientific community, we have realized that the key stakeholder that we need to understand, not only respect, but also understand and listen actively, not only passively, is the patient community. Because at the end of the day, we're working for the patients and for the entire society. We have to remember that we all are patients and will be patients in a given moment, right? So I think, Baiba, I heard what you said yesterday in the meeting. I could see your passion, your absolute determination to work on all this direction. What would you say from the patient community perspective that should be done for creating a really efficient ecosystem of cooperation with these scientific institutions to make sure that solutions are going to be developed? And what do you expect from us?
First of all, thank you for inviting me. I really love the international expert companies because that's I have spent past 20 years among people and abroad with different scientific and medical backgrounds, and that's why sometimes I'm very rude towards people in Latvia because I see that it works abroad and I can't understand why it sometimes doesn't work here. So as I also understand the very huge role that I have as a chair of our network of patient organizations because I have to first lead by example. I have to teach other patient experts. I have to find and help patient organizations have perfect governance structures so they can be, so nobody would ever question our reputation or the dedication why we are doing this. I have to teach the community, I mean like all society, that there are three roles of patients. There's a patient, patient expert, patient organization, and each of us has different things. I think I will write an email to Ministry of Education because I have like this experience when I was trying to do the Horizon project as a patient organization. It succeeded. Well, it didn't get the funding, but it got all the points. And as a non-profit organization, I couldn't get the support that other organizations could apply for. And I think that is like one of the things that we have to change if you want to include patient organizations. We have to teach them, and we also have to provide tools so they are interested to participate, and you as these fabulous scientific communities are ready to share the knowledge with us. It will take time until we get to the point where all scientists are at the moment, but each patient has their professional life, except those that, some of us were born with some kind of disease. But I think the role is very important, and the task we have to carry out is like very, very important, and some of us don't realize it.
Yeah, just to give you an example, in the last few projects that large European project where EATRIS is collaborating with other organizations for the development of solutions in the translational medicine ecosystem. We were discussing before an IHI project for developing new methodologies for clinical trials in small populations for rare diseases, also for creating new regulatory guidance for advanced medical products. Patients are partners of the project. Patient organizations are partners of the project. I can tell you, based on our experience, that has been extremely important for the scientific community to shape the profile of the questions that we wanted to ask, and also to bring the patient perspective to make the research process more efficient and more feasible. So I really hope that now Latvia will be a great example, a great proof of concept that scientists, patients are part of the same journey. But talking about the scientist, let me ask you a very direct question to both of you, which is a very simple question. Okay, now you are members from now on of a European large organization that give access to, let's say, many, many things that are happening at the wider European level. What do you expect from us?
Well, I hope it works.
Or what? Yeah.
So I guess it can be heard easily, right?
Yeah.
So, anyways, one thing that you want to hear the mic, really? Okay, no worries. Anyways, one thing that we, one of the issues that we have here, this is a small country, which means that, I mean, the resources more or less are limited. And we can't afford to have excellence center on every subject and have infrastructure that covers every possible necessity that might arise due to our ideas that has to be implemented. And being a part of EATRIS can help us in these things. Another thing is that when it comes to translational medicine, we've had a discussion yesterday about some legislation difficulties that actually prohibit conduction of translation of the research results to practice. And one thing that we lack because of that is experience how to do these things. And I noticed that one of the services that EATRIS provides is to go through this IP management and how to go forward and how to conduct larger clinical trials. This is one of the expertise that is missing here a little bit. And this is one of the things that I think my colleagues are going to use. One of the issues that my organization has, we are furthest away from the patient, because we don't employ any doctors actually, unless there's a project which requires employment of the doctor, then we do. And we are further away from the industry than the Institute of Organic Synthesis. And what we have actually realized is that to conduct successful investigation, you have to engage participants, patients. You have to explain them the meaning of the project, why are you doing this, what are going to be the benefit. And we have also come to realize that actually through engagement of patient organizations, we gain more power, because they have more power to push through to the government, because they more or less represent the society. We are just, smaller part of the society that is kind of, doing the research. They are the ones who have the need. This is the connection with the society, and what we do, we gain more power to push through the necessities that have to be done, the things that has to be done to gain the improvements here, so that whatever we discover can be translated to real practice. And one of the things that we have actually done is our colleagues did exercise on citizen science, where you actually offer people to be part of the study. Actually, and many people actually were even ready to finance some part of the study just to get the results out of it. For example, there was this microbiome study. They wanted to know what stuff lives in their bellies. We wanted to know what stuff lives in the general population bellies. And it worked really fine. There was some bias, of course, because people who were ready to engage, they were usually more educated than people who were not ready to engage. And what we saw in the diet diaries was that the diet differs quite heavily from the average what you could expect. But anyways, it worked fine. We got the data, and we have some studies that have been successful using this data.
I guess I will continue on the same topic as David's did, because even being closer to the patients doesn't mean that always we don't have any worries about conducting our research. And if you're talking about like biomarkers discovery, the one thing is if you're working on the diseases which are rare, comparably rare, and accounting our population, it's of course easier to collaborate in the platform when you have more partners with the same, working on the same diseases. But one is the patients, but the second is the control group, which we are expecting as the normal healthy population. And sometimes using access to different biobanks is also contributing to validate things that we have discovered or which are important. But continuing on the perspective of the patients, I think another thing which is very important on the scientist side, that we probably need to put more efforts communicating with patients and teaching them about what we are doing, because many times we have across the question that it's science and we are not benefiting from that. It will be something in the years ahead, but communication and discussion and explaining what we are doing, making it, I believe, more real also for patients. And that's, I think it's what is on our side. We should do more.
Baiba mentioned something yesterday during the discussion that for me, I think is a key element that we put always in our narrative. Oh, sorry, thank you. No, Baiba mentioned yesterday in the open discussion that we had, because she was with us yesterday, something that we always say in the narrative, blah, 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 but it's very difficult to make it actionable, and for me it's the key point. She said, and I completely agree, we still work in silos, right? We do a great job individually, but we do our job in our area of competence. And we do not realize that for the big transformative changes, if we want to do something really big, we have to do it together, because no one, absolutely no one, has the capacity of tackling a big challenge from their individual perspective. And I think that for a country like Latvia, this is very important to develop a clear strategy, because you are competing with the big players, countries that have huge presence in the research landscape, that have the same capacities that you have, the same, but quantitatively multiply because they have, there is, for instance, Spain, the country I'm coming from, just in the region of Catalonia, there are 72 research institutions, right? Because it's more or less the same size than Latvia. So I think there is one question, and you mentioned in the presentation of the strategy, this concept of smart specialization, that at some point you are, and this is something that is going to happen, it's already happening, it will happen more in the next few years, and when you come to EATRIS and you plug into the discussions of the EATRIS, you are going to realize that it's going to be critical to identify the real added value that the Latvia contribution can mark, right? This is going to be, for me, a critical point. But for that, we need to break the silos, right? So how can we break these silos at the national level and make sure that what you do in the university and what you do in your institute is something that can complement to each other, respecting your own identity and on the other hand, healthy spirit of being competitive, that is what makes science to progress. How can we find this balance in being competitive, publishing great papers, developing great collaborations, but on the other hand, working with your colleagues for doing something that individually you couldn't do? This is open for all of you. Well, go ahead.
Actually.
Yeah, I think so, no?
No.
Yeah.
Actually, you know, I've been in different silos. Yes, and I survived. One thing I don't like, and I mentioned it already quite many times, I don't like when we call us small. We should forget to call us small. We are large enough. Just simply compare us with other countries in the Europe. On the other hand, we are small enough to ensure quick communication between the silos. But a pity we are not doing it effectively enough. Although on the other hand, not so bad, because we do have good examples here in communication between silos. Institute of Organic Synthesis is one very good example in communication of research in small molecule active substances, active pharmacological substances with our pharmacological industry. We are actually, most of us, working in biomedical fundamental science. One or other way, we have found cooperation with our hospitals, despite the situation where hospitals are a part of educational and scientific system. So we are solving the problems on daily basis, on the basis of the need. We would be very happy to have a better situation, but we have to deal with that what we have and hoping in the future to improve it. So we'll never have the ideal situation, but let's deal with that what we have and we'll achieve the result.
Can I ask one question before we continue? Are in this... Sorry. Can I ask one question? Are in this room representatives from the clinical institutions, from hospitals? One. Interesting, yeah. Because I think we all agree that this is an absolutely essential part of the translational medicine value chain. I will go back to this later.
I want to probably comment on those silos and keeping a competition, yet being it healthy. One thing I believe we have to do is we have to compete with the ideas, not with the activities, which means we are competing when we actually submit grant proposals. This is the moment when you are kind of keeping your mouth shut until you receive the funding. But you don't compete when it comes to actually doing things. You start collaborating at that level. If you need somebody else to complement your knowledge, you reach out to them. and ask, can you help me on this one? And the other one has to feel the obligation to actually help. Not to just, not to just consider, you are doing this one, I'm going to keep it in mind and then try to adjust my own plans accordingly. So, and the other thing that I believe people have to do is, one of the things that I really hate and love in my institute at the same time is we have these yearly reports about how you did last year. Our administration uses it to communicate with the ministry, and this is a very convenient way because I don't have to worry about these things all year. But one thing that comes out of it, I hate writing the report, but one good thing that comes out of it is that you see how well you performed this year, and then you compare it to yourself last year. And if you performed better than you did last year, then this means you did good. You don't have to always look at everybody else around. If you kind of stick to this philosophy that you try to measure to yourself for tomorrow, and then the success is going to come. You're going to take your place in whatever the competition table there is. This is how I see the situation. So.
Can I just say something, talking about the competition, because I think policymakers, they have huge work to do. Because actually yesterday we were discussing when the different institutions were presenting what they did. The first slide in most cases was the number of publications and the impact factor, because it's what the policymakers ask, right? But translational medicine is nothing about what you publish in 1 year and the impact factor. It's a long journey that requires a lot of trial and fail. And you have to identify tendencies and another kind of impact KPIs. And of course, the institutions are going to follow what the policymakers say because they are funding the institution, right? And I think there is a huge responsibility here in the translational medicine to help with the policies to make sure that people are ready to invest their energy in a journey which is long, because no drug, no medical device is going to be developed in just 1 or 2 years. We are talking about stories of 10 and 20 years. Please.
Yeah, maybe a few words about this change of paradigm in funding. During the last 2 or 3 years, we have new developments called state research programs or long-term research programs. And I think this is kind of game changer in policymakers' behavior. They start to realize that we need more than a year or half of year, and they start to realize that we need not to publish something, but we perhaps need to create something. And I think that currently this mindset is going to be changed. It is, of course, evolutionary process, not revolutionary. But currently we see rather progressive developments in that respect. Thank you.
And one more point, probably, which was not so much raised here. I think we also should, on this perspective, on collaboration perspective, think about our young scientist generation. And they will be those who will be the game changers, actually. We will start ideas and we will flood them, but we should put more effort and exchange of ideas with our younger generation. That's also, I see as EATRIS platform is contributing to that as well.
My 5 cents, and probably you don't know that, but in Latvia we have a saying that there are 2 persons and 3 parties usually, because we just can't agree, and we love to create something new because we can't use the one already existing structure. And I think that is another beauty that our country with the limited population, not small population, has, because that's making us very close, we know each other, we can always call up people. And I think I have also seen from the institutes that they have these visits in which they bring patient organizations to come and visit them so they can learn and understand how the scientific processes are happening. And we have these researcher nights, and those are very popular, getting more and more popular among young people as well. And I think we have to teach the society that science is cool, and everyone here is like very smart and fantastic job that we are doing. So one day they will understand. We won't have like this health literacy issue that we had during the COVID, and now when people just don't understand the basic things about their own bodies. And I think, yeah, that's why I'm saying we still have a lot of things to do, and it would be much easier and cost efficient if we did it together.
Well, I wanted to comment also on what Osvalds told about scope of thinking, which has to be changed in our government, because I remember when they were opening the new facility at your institute, the building in the yard, there was the minister standing there and talking that he doesn't expect for the outcomes from building this facility in a year or two, but in 5 years, everything is going to pay back. So this is kind of an anecdotic way how to explain that. Actually, when you invest in science and in translational medicine, you have to think in the span of 20 years, 15 years at least. You can't expect things to go through 5 years, which is approximately what every politician thinks my career is going to be. After that, it ends because there's a new election. Yeah, and about our national identity, we had a joke during the COVID that when the government placed the regulation that you have to keep 2 meter distance from each other, everybody kind of was sad and they kept those 2 meters. But when the government lifted the ban, everybody was so relieved and returned to the typical 5 meter distance from each other.
Wonderful, yeah, wonderful. Well, we are today in the environment of dialogue about personalized medicine, right? Because this is the personalized medicine conference. And it's quite interesting because if you think about the concept of translational medicine, it's very, very parallel to the concept of personalized medicine, because at the end of the day, means that the discovery that you generate is going to have an impact on a specific need on a specific individual in a given circumstance. That paradigm that was discussed today as giving to the right patient the right intervention at the right time and at the right dose, right? This is translational medicine, right? So, are you now fully prepared for, let's say, tackling this challenge of creating a Latvian strategy of personalized medicine? You think EATRIS Latvia could be something that can help in one way or another one? I would really love to hear your thoughts about the challenge that you have as a country, which is exactly the same challenge that countries that are very different culturally and also geographically have. So what would you be your ideas or your thoughts about this challenge that we all have, and is going to be at the end of the day the medicine of the 21st century, of the remaining 21st century that we are going to give as a legate to the next generation?
Actually, sometimes I don't like speaking about personalized medicine. Medicine actually has always been personalized. Any other patient is individual, and doctor has to find right ways to cure him or her. In the modern times, personalized medicine is actually to find better tools to help doctors to set the right diagnoses and to choose the right therapy. That's so simple, from my understanding.
So practically we can discuss that. Yeah. But I mean, in this idea of identifying, creating an ecosystem where the right tools will be developed, or stratifying patients, identifying the target drugs, using data science for exploiting and segment patients, this concept that is called precision/personalized medicine. What's the reality and what needs to be done? And also my question, I think is relevant, can EATRIS play a role here? And if so, how can be done?
Actually, there was one session dedicated to this task, right? there was a huge, I guess just before, there was a huge table here, and there was a lot of people sitting around, including you in the middle. And I was sitting there, and what I realized is that we have a lot of thoughts how to do these things. We're not there to actually have an agreement how to proceed. But it was quite clear we need to engage patients. There has to be understanding between the doctor and the patient. The communication is the important part. And we even discussed things that shouldn't be done. For example, we shouldn't build and invest a huge amount of money in building one precision medicine center. Instead, we should use whatever resources we have already invested to kind of push it all together to make people work together. And this is one of the things that you addressed before. And you can probably help us. I mean, it would be great. I mean, the session was in Latvian, right? So it'd be great if the session would have been in English and you would have been participated in this. My guess is that in the next PMNET forum, you can actually repeat this exercise, and maybe you could invite people from EATRIS to join it, to have some additional thoughts about it, some additional view from outside, because everybody that was participating there had a view from the inside. So
I also have that was very practical, because the ministry official from health ministry, she said that there are many policy documents opened at the moment, and that we can include things that the projects and ideas that we have already identified into these political documents that they are using at the moment. And I also think that yesterday probably you had on the slide something about value, about evaluating things. We have a huge problem here with data. We can't get personalized outcome data out of any register we have, and maybe that's could be one of the future initiatives that we could think about how to do that, because there are many barriers in legislation that patients, when doctors find the solution that the scientists have discovered, patient can't access it because from yesterday, day before, the level of individual reimbursement is doubled. Now it's 30,000 euros, but it's still not enough. They say themselves that the biggest reimbursement for one patient in a year is 654,000 euros, and it's like a huge amount of money. And I happen to know this person, and the medicine he uses for this huge amount doesn't work in that body. And that's why I think we have to find solutions through the new digital health authority that we are establishing, how to find where are these places in which we can make meaningful changes, because then we can show that this works, that precision medicine is something that we definitely need in our country, because we have to help each patient, each person in the country we have.
Yeah, I think something that we have observed in the personalized medicine ecosystem in Europe is quite interesting, because you know that the European Council officially adopted the definition personalized medicine, which is very similar to the concept of precision medicine, because at the European level they wanted to bring to this ethical element of what Ilmars just said, that we have to make sure that that patient is our focus. No, we are treating not a pneumonia, but a patient with pneumonia, which is completely different, right? But in the development of the personalized medicine agenda over the last 10 years, all these concepts were very clear, but then when you want to bring it to the real solutions, then issues such as innovation management, regulatory guidance, reimbursement, health technology assessment to compare with a standard of care become a huge problem, right? And this is something that I believe that would be very important for this community to work also not only with the policymakers, but with HTA bodies, technology transfer officers, right, to make sure that all this knowledge is put together. Because otherwise, what we are going to have is a personalized precision medicine ecosystem that we are going to talk about science, 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 and science. But you want to bring it to your patient, right? To the patient, the best solution, the best drug, which is going to be different from the drug they're going to give to another patient because it belongs to a different group.
Yeah. Toni, you asked. I'll tell you what I would be very happy to see EATRIS dealing with. In Europe, in every single country, we do have different situations. And it's actually a tragedy. What EATRIS should work on, it's to bring some, at least minimal standards, which we all share. And I mean not only the minimal standards about financing of drugs, which would be great, but it's money, it's always difficult to find. But the minimal standards in the meaning of what do minimal ethical standards mean? What do minimal standards for personalized information mean? So we can, such practical things as that European citizens can buy prescribed drugs in different countries, and it still isn't working. Although Latvian prescription drugs can be bought now in a couple of countries, but it's really in a couple of countries. And the same thing with Spain. Spanish people are, they are forced to be cured in Spain, and other people too. And of course, to some extent, the tourism of patients is taking place. But this is some workaround and is more medical business than the normal situation. What we need, what we really need in Europe, it's a common understanding in medicine, in translational medicine, because the pharmaceutical companies in Germany have another situation compared with pharmaceutical companies in Slovakia or in Latvia. They have to deal with different legislations. So these are, although this example maybe is the best one, that the legislations are more or less equal, but in very many different situations, we are working and dealing with different situations. We spoke about biobanks today in the morning session. And we mentioned Estonian biobank as a good example. They have absolutely another legislative situation in comparison to Latvia, and also with the most of other European countries. They have set it up as one of the national priorities, and they have extremely good result. And what EATRIS could do is to bring the best practices from the member states together to say, okay, it's working at the national level. Why we don't implement it in all the countries instead of reinventing bicycle?
There are structures to help with that. We have European reference networks and cross-border healthcare directive. The problem is that our budget is so small and we can't afford sending people abroad always when they need it. Because even like for regular services, you should be able to go to Lithuania or Estonia to get like some...
That's why I found somebody else who's doing that for us.
Nobody else will do it for us. We have to do it ourselves. Otherwise, it's never done.
Well done. So we have 10 minutes, and I love to use these 10 minutes for the audience to ask questions to the panelist. So please step in. Someone has to break. Yeah.
Thanks. I would like to go to perhaps a point of tension between two different ideas. One idea is that translational medicine just research, and especially in medicine, takes a very long time to get, let's say, to the patient. And so we have to realize that there will be a 15, 20 plus year process overall from fundamental research to the patient. On the other hand, something that Zanda brought up is that it's important to communicate what is the benefit for the patient to be involved now. Perhaps I would appreciate discussion on how that gap is being bridged and how do you bridge that gap there's an inherent contradiction saying it will benefit you now, but it's also going to be in 10, 15 years. So yeah, perhaps something on that. Thanks.
I think Elise can say something about that, about the patient engagement and involving the patient in early stages of the research value chain, because that's something that for EATRIS is a key element.
I would say Baiba is probably better to respond to that specific question. Yeah, in terms of educating patients on the benefits of the right now as well as the future, I think there's just a little bit more funding needed, and I think the burden lies also with researchers, and to educate researchers on how to do better science communication as well, because I think a lot of people are fantastic experts in what they do, but it's not always easy for them to come out of that environment and be able to speak it in lay language to engage with patients. So, well, maybe I will use this moment as a little bit of a pitch then. One thing, concrete example that the EATRIS has done so far is we came together 3-4 years ago, and we designed this sort of center for resources for researchers to find different sources from already produced materials to be able to educate themselves in the various stages of how to engage with patients within basically along their continuum of the research cycle, basically, indeed. And I'm actually really happy to say that as a and Latvia was already included in this project, RSU was included, and they already did some really nice work on patient engagement, well, Latvia specifically out of all of our 14 member countries. And I'm very happy to say that Latvia will be our patient engagement champion and task leader also in the continuing project. So I'm really happy that over the past 2 days, actually, patient engagement has really been the center of all of the discussions. And we will continue together on patient education and researcher education on patient engagement.
I wanted to comment, from our experience, engagement of the patients to convince them to participate is usually not an issue, because they are already usually suffering and they want this state not to be repeated to anybody else in the future, even if it is a distant future. The issue is usually engaging the healthy cohorts, because if somebody doesn't have any health issues, they actually don't want to participate in anything. They don't want to donate, most of them don't want to donate blood, they don't want to do anything. Patients is, they wish to receive knowledge and you can communicate with them. They are actually asking the question in most cases. Sometimes even if it is not the patient, it's going to be his family members who are going to ask the questions. And then you can easily educate on individual basis. The issue is usually the society in general. We had a really good exercise with Olga. Olga is also leading, Olga Valtin is also leading one of the patient organizations. And during the COVID, she made this event about how to identify false science, because during the COVID, there's a lot of people talking about false science and trying to bring it as a real proof. And I mean, when you look at these things and you look at the people who believe in these things, you realize that you have to engage the society in general. There has to be more engagement. You need to invest into educational system. You have to make sure that most of the Latvians have some understanding on the life sciences, on medicine, on physics, so that they can take a really, responsible decisions to participate in these things. So the issue is usually the general society, not the patients, because patients are usually suffering and they want the suffering to end. Am I right?
We even have research to convince you with data, because EATRIS, which is European Organization for Rare Diseases, has done a survey of like many thousand people around Europe who has rare diseases, and 98, if I'm not wrong, % of us really believe in science, and we want our data to be used for science, and we are ready. Like the gap that we have to close is about that most of the patients, when they first come and become the patients, they don't know anything about how to read science papers, where to go, where to start, and then from all other stakeholders. That's why I keep saying all day long today that there are three different types of patients: patient experts, and patient organizations. And they all have totally different roles. They are overlapping, but when you need to like send out some kind of information, you always can find a patient organization. When you want to gather some information, I haven't received like much of requests to like ask people, but every time because I'm I'm a market researcher by training, and I love research, and I was told that because I have this duty towards people, I have to teach everyone to respond to surveys. So every time when I receive surveys, I always send it to my network, and I expect them to send it over to real patients, because I really believe that data will change the world.
Some small thing to add. I think the one question is about the health literacy and also understanding what scientists is doing. But I think another part, hard to say how large part of it, is how much society trusts the state and the state organized research or biobanks. I think also Estonian biobank did this kind of survey, and I have seen surveys from Finland. The trust society in the state actually is reflecting how much they trust in the science, what is state-funded science, and what they expect from that. And maybe some parties that we individually conducting some research should ask the feedback of the involved not only patients, also control group, what you expect out of this research, to understand better why probably sometimes we are not so successful on that.
Well, I think we need to start wrapping up, and I would really like to conclude this meeting with maybe some general reflection about this journey that now, one of the multiple journeys that Latvia is involved in, a new one that starts now, which is the participation in EATRIS, right? And I think that I clearly see this kind of particular added value of the translational research community in Latvia, that because of the particularities of this ecosystem, there is this easy capacity of dialogue, which is the necessary condition for breaking silos, right? There is also the capacities of the entire translational value chain. What you have in your institutes is what is necessary to create this solution. There is a real possibility for establishing a culture for cooperation, which already exists, and hopefully EATRIS will help you to reinforce. And there is a real presence of the patient's voice, right? And the fact that you are in this table today, I think, is a good example. So this is a journey where all are involved, including, by the way, the policymakers, and including also those stakeholders that are essential in the value chain, which is like the industry, which is the regulatory bodies, HTA bodies, experts in innovation management, and technology transfer offices, because this is about research, but it's about how to use research to solve citizens' challenges, right? So we are here to support you, and I really hope that it's opening this door that we call EATRIS to things that are happening in the European mainstream will also help you to reinforce this identity, and also we ask you to learn from you, because there are so many lessons that other European countries we can learn from the experience of Latvia, that also for us having you on board is a real privilege, and we really want to share this adventure and this journey with you. So thank you, and I really hope that the next year when we meet again in the context of EATRIS Latvia, we will see wonderful examples that translational medicine is possible. Thanks to all of you.
Thank you.